the topic of discussion that we are going to have right now is we are going to talk about the fascia of neck and the spaces within neck region. Okay, and what are the fascias in neck? The fascias that are present in neck is called deep fascia of neck, right? Okay, now talking about what we are here talking about. Okay, now what we'll do, we'll go through all these images and we'll be clear about what the fascia of neck and spaces within neck. Now yes, I mentioned that the neck fascia, what we call neck fascia, it is, what is the neck fascia called? It is called deep cervical fascia. Deep cervical fascia. It is not just called deep cervical fascia, it is also called fascia coli, right? It is also called what? Fascia coli, and it is the deep fascia of neck. Now if we go what? Now the most superficially, what is there? There is our skin. Right, now if we go inward to it, we'll find what? We'll find superficial fascia, right? And then deeper to it, we'll find deep fascia. And here what we're talking about, we're talking about deep fascia within what? The region of neck. That is what? Fascia coli or deep cervical fascia. Okay, now without delay, let's move, right? Okay, now the cervical fascia, right? Deep cervical fascia or the fascia of deep fascia of neck, it consists of how many layers? It consists of 3 layers. Now what are the 3 layers? The 3 layers are the first one, investing layer or fascia, right, or layer. Now it is the most superficial one. Another one is our pre-tracheal layer. Now pre-tracheal layer, from the name it suggests pre-tracheal, that means just around the trachea, right, in front of trachea. And we have got pre-vertebral fascia, right? Pre-vertebral fascia, that means in front of what? Vertebra. Now okay, one important point is that this pre-vertebral fascia, it also forms what? It forms the floor of posterior triangle. We'll get to these things again clearly, don't worry, through diagrams we'll get these things clear. Floor of posterior triangle is formed by pre-vertebral fascia, but talking about the roof, it is formed by what? It is formed by our investing, right, the upper one, the investing fascia or layer. Right? Okay, now okay, let's move toward this diagram. Now in this diagram, what we'll see is this, right, the light blue color, right? What is this? This is our what? The most superficial one. What is the most superficial one? The investing layer, right? The investing layer or the investing fascia. Okay, this is the most superficial one. Now when we'll remove this investing fascia, for example, we have removed this in these regions. Now when we'll remove this investing fascia, what we'll see? We'll see the other two. One is the pre-tracheal and pre-vertebral fascia. Okay, pre-tracheal and pre-vertebral fascia, and I have already mentioned that this investing fascia, what it does, it forms the what? Roof of what? Roof of posterior triangle. Now where is our posterior triangle? Posterior triangle is somewhere right here. Now how we came to know that this is posterior triangle? We came to know because what is this? This is sternocleidomastoid muscle and this is trapezius muscle, right? It is bounded by these two things. So this is posterior triangle. Now as you can see, the roof, right, the roof is formed by what? The roof is formed by our investing fascia. That's all. Now moving further about what? About these two things, right? Now as we'll remove this investing fascia, we'll find what? Pre-tracheal fascia and pre-vertebral fascia, right? If you'll see this region, what is this region? This region is our what? Posterior triangle, right? Posterior triangle. And I've already said that the posterior triangle, the floor is formed by what? Our pre-vertebral fascia, right? Pre-vertebral fascia. We'll go toward these things in detail, don't worry. And pre-tracheal fascia, right, it is present where? In front of what? In front of what? Trachea. In front of trachea. It is not just bounded to in front of trachea. It is what it is. It is what it is found in what? It is covering everything, esophagus, pharynx. We'll go to other things shortly. Okay, now we're talking about what? We're talking about investing fascia, pre-tracheal fascia and pre-vertebral fascia. And one important fact about these fascia is that all these fascia, what they do is, all these fascia, they contribute to carotid sheath. Now carotid sheath, we need to know about carotid sheath also. Now in this carotid sheath, okay, as you can see, what is this? This is our carotid sheath, as you can see, right? In this carotid sheath, most superficial is our what? Obviously, in this carotid sheath, the most superficial is our what? Investing fascia, obviously, right? And then anteriorly, it is formed by what? Anteriorly, this is our carotid sheath that we are talking about right now. This is our carotid sheath, right? It is enclosing various important structures such as common carotid artery, right? That will continue as what? Internal carotid artery. This is medially present, and then what we have got inferior jugular what? Vein, right? In jugular vein, and then in between of these two structures we have got what? We have got vagus nerve. Okay, these are the content of carotid sheath, and in this carotid sheath, the most superficial structure is our investing fascia. And then what we have is anteriorly it is formed by what? It is formed by our pre-tracheal fascia, right? Pre-tracheal fascia. And talking posteriorly it is formed by what? Posteriorly, obviously, one remaining, that is pre-vertebral fascia. So all these three fascia, they contribute to carotid sheath. This is one important point. Okay, now here in this diagram, now let's just have transverse section. We'll just cut our neck like this, right? And then we'll just watch it from above. Or okay, what is going on is that what we are doing is, now we'll observe, right? Okay, we have got it is like this, right? We are going to observe this section of neck, not head but of neck. And anteriorly, what we have got? We have got nose. Now here we have got we have got ears, right? So this is the view that we are going to have now. So now, okay, the same thing is right here. If you can see, what is this? This is the nose, right? Now here we have got what? We have got ear somewhere. Now here we have got what? Vertebra, right? At the back, vertebra. And we have got trachea, esophagus, like this. So we are going to have we are going to look at this structure. Now looking in this structure, right? Okay, here the outermost one, right? The outermost layer that you will the one that you will see in yellow color. What is this? This is the outermost, right? What is this? Sorry, what is this outermost called? It is called investing layer, right? The most superficial one, the investing layer. It is the most superficial one. One important characteristics of this investing layer is that at some points what it will do is it will split. As you can see here, it is splitting, right? It is splitting, and it is enclosing some of the muscle. Here it is enclosing one muscle, and similarly, as it is going like this, it is also what? It is also enclosing muscle right here, right? Similarly, these muscles that will enclose this one is our sternocleidomastoid muscle. This one is our what? This one is our trapezius muscle. And we have known that these trapezius and sternocleidomastoid, what they are doing? They are forming the borderline of what? The roof of our what? The posterior triangle. So investing layer, okay, the investing layer, what it is doing? It is what? It is the most superficial layer. What it is doing? It is enclosing some of the muscles such as sternocleidomastoid muscle, and what? It is also enclosing trapezius muscle. And doing that, what it is doing is it is forming the roof of our posterior triangle. So this was about some of the important feature of our investing layer. Now what we need to do is, about this investing layer, we need to know about what? We need to know about its attachment. Superiorly, it is attached to where? Okay, as you know, we are talking about the cervical fascia of neck. Superficially, it is attached to, right, occipital protuberance at the back, at the occipital bone. At the occipital bone, it is attached to occipital protuberance, right? We talked about what? We talked about, okay, posteriorly it is attached to occipital protuberance, right? And along with occipital protuberance, it is also attached with what? Superior nuchal line. Similarly, talking what? Inferiorly, obviously it will extend what? It will extend to this region. So what are the in this region? What we have? We have scapula, acromion, clavicle, right? Inferiorly, it will be attached to what? Clavicle, right? Clavicle, as you can see right here, the clavicle. behind, what is there, what we have got behind we have got scapula, we have got acromion, right? And here also what, this region also what we have got, manubrium. What we have got manubrium. Okay, manubrium. Okay, these are the inferior attachment, posterior. And what about the lateral attachment? The lateral attachment, it is attached with mastoid process and zygomatic arc, which are mastoid process, it is also the part of what our what skull bone. So these are the attachment of our what, investing layer. Now let's move further. Now moving further, okay, what we mentioned that this is the one in yellow color. What is this? This is our investing layer, right? They are here what, they are here somewhat dividing and enclosing some of the muscles, right? Some of the muscles such as sternocleidomastoid, trapezius. Okay, now moving further, what we will see is, we'll see about what, pre-tracheal fascia. Now pre-tracheal fascia, what is this? This is our trachea, right? This is our trachea. And here you will see, what you will see, right here, you will see the lobes of what, thyroid gland, lobes of thyroid gland. It is the isthmus, in middle is isthmus, right? Now here what is this? This is our esophagus. This is our trachea. This is our what, thyroid, right? Now just in front of this trachea, what we have got here, we have got pre-tracheal fascia, right? Pre-tracheal fascia. Now it is what it is, mainly it is just in front of trachea, but what it will do is, it will continue as, behind as what, buccopharyngeal fascia. Okay, buccopharyngeal fascia. Now here, okay, as you can see, what is this? This is our pre-tracheal layer, right? Pre-tracheal layer, muscular portion. It is mentioning the muscular portion. Why it is mentioning muscular portion? But because here this will what, this will include what, the muscles. And similarly we have got pre-tracheal visceral portion. What it will do is, it will include the viscera. What are the viscera? The visceras are our what, the thyroid gland, right? We have got trachea, right? We have got esophagus. These are what, these are the viscera that is covered by pre-tracheal layer, especially pre-tracheal visceral portion. Similarly, pre-tracheal layer, muscular portion, what it includes, the muscles. Okay, this was about what, this was about pre-tracheal layer. Now moving further, what we have is this one. What is this? This is our, okay, we were right here. What is this? This is our what, this is our, okay, what is this? This is our, obviously the last remaining one is our pre-vertebral layer. Now why it is called pre-vertebral layer? Because if you will see clearly, what you will find is, what is this? This is our vertebra. Okay, let me write it, let me show it like this. What is this? This is our vertebra, right? This is our vertebra. As you can see. Now just in front of our this vertebra, what we have got, pre-vertebral fascia, that we drew it right like this, right? Now the important thing about this pre-vertebral layer or pre-vertebral fascia is that it is not just in front of what, vertebra. As you can see, what it is also including various other structure, right? Pre-vertebral muscles also, as you can see right here. These are the muscles of what, pre-vertebral area. So not only in front of vertebra but also around pre-vertebral muscle. This is our what, pre-vertebral fascia. Now just the point that I have already discussed earlier. What is this? This is our carotid seed. What is this? This is our carotid seed. As I was saying, carotid seed is what, it is contributed by what, it is contributed by all the fascias, right? In front what we have, okay, in front, right? Okay, in front what we have right here, we have pre-tracheal fascia, right? Laterally what we have here, the yellow colored one, right here you can see. What is this? This is investing layer. And posteriorly what we have is, we have vertebral layer, pre-vertebral layer, right, pre-vertebral fascia. Okay, I'm repeating again. What is this? This is our carotid seed. Anteriorly what we said, it is made by what? Our these. What is this? This is pre-tracheal fascia, pre-tracheal layer. And posteriorly what we have? Posteriorly we have pre-vertebral fascia, and laterally we have what? Investing layer. So carotid seed is formed by all these, it's contributed by all these layers. Now we have what? We have brief idea about what? We have brief idea about our these fascias, right? Investing fascia, pre-vertebral fascia, pre-tracheal fascia. Okay. Now, yes, talking about what? Pre-tracheal fascia. Okay, pre-tracheal fascia, what I was saying is, this is what? This is our pre-tracheal fascia. What it is doing, it is what? It is not just in front, of trachea, but also what? It will go behind, right? It will go behind to pharynx and esophagus, and it will what? It will just circumferentially, it will what? It will bound to these structure, pharynx and esophagus. But this fascia, what is this fascia called? It is called buccopharyngeal fascia, right? It will change its name and it will be buccopharyngeal fascia. Yes. Okay. Now talking about, yes, we talked already that it has multiple layer. What were the multiple layer? That were our muscular portion, right, and our visceral portion, right? And talking about the visceral portion, what it was enclosing? It was enclosing the thyroid glands. It was enclosing what? Trachea, it was enclosing esophagus. Okay, and these were the thing that we were talking. Okay, now what we'll do is, we'll just move further and we will see these things, right? Okay, we'll see these things right here. The same story, right? Same story. The outermost one, what is this outermost one? This is what? This is our investing layer, right? The investing layer. Okay, and then inside what we have this pre-tracheal, right? In pre-tracheal also we have what? We have visceral pre-tracheal fascia, that is enclosing thyroid, trachea, esophagus, right? And then we have what? We have muscular pre-tracheal fascia. What it is doing? It is just enclosing, what it is doing? This muscular pre-tracheal area. It is what? It is enclosing the muscles in what? In anterior part of neck, right? Anterior part of neck. Now yes, we talked about superficial layer of the outermost one, right? Now we need to what? We need to talk about what? We need to talk about, okay, okay, let's, what is this? This is, okay, what is this? This is our what is this? This is our pre-vertebral fascia, pre-vertebral, right? Now we need to know about what? We need to know about several spaces also, Now what are the several spaces that we will be studying? We'll be studying about what? Retropharyngeal space, right, as it is mentioned right here, retropharyngeal space. And there are other space also, pre-vertebral space, death space, right? Okay, we'll be talking all these things, will clear in this diagram. Okay, what is this? This is vertebra posteriorly, and in front of vertebra what we have? We have pre-vertebral fascia. Yes, pre-vertebral fascia. Now between this pre-vertebral fascia and vertebrae we have what? We have what? Pre-vertebral space. This is the one space that we are talking about. This is pre-vertebral space. Now this pre-vertebral fascia, it is also what? It is divided into two parts. One is our LR fascia, right? LR fascia, and another is our pre-vertebral fascia proper, right? Pre-vertebral fascia proper. So what we can say is this pre-vertebral space is exactly what it is. In fact, it is between what? It is between pre-vertebral fascia proper and our this vertebra. Now between this pre-vertebral what? Fascia proper and our this LR fascia, what we have is, we have dangerous space. What we have? We have dangerous space. Now this dangerous space, we can say that this dangerous space is present within this pre-vertebral fascia only, right? Okay, now moving further, yes, what this was our overall what? Pre-vertebral fascia. Now if we'll go further, what we'll find is, we'll find trachea, right here, trachea, we'll find lumen of pharynx, right? Now in front of trachea we have got pre-tracheal fascia, right? It runs anteriorly, it runs anteriorly and lateral to this trachea. Now this trachea, what it will do is it will just enclose, right, this lumen of pharynx also. It will go all the way backward and it will form buccopharyngeal fascia right here, buccopharyngeal fascia. And there is space just behind what? Pharynx, lumens of pharynx. Behind lumen of pharynx, or we can say there is space behind buccopharyngeal fascia. That is what? That is retro. What is the meaning of retro? It is behind. Now the behind, what? This is our what? This is retropharyngeal space, or we can say between LR fascia and our this buccopharyngeal space, buccopharyngeal fascia, we have got retropharyngeal space. So these are about what? These are about spaces and fascias, schematic diagram. And this dangerous space, why this is called dangerous space? It is called dangerous space because it can what? It can help us to pass from what? Vertebra, tubercular vertebra, right, to what? To our mediastinum region, that will lead to what? In thorax region. It is called dangerous space because from this vertebra, if these are tuberous vertebra, then what will happen is that this tuberous vertebra, from this tuberous vertebra, pus, right, pus can pass through this region and enter into thorax from mediastinum. So it is called dangerous space. Okay. Now again, just for our broad understanding, let's take this diagram, right? What is this? This is superficial. Okay, superficial layer, right? What is this? Superficial layer. Now within this superficial layer we'll find one space, that is superficial space. We haven't talked about this thing earlier, so this is the superficial space. Okay, now let's move to this one. What is this? This is nothing but our pre-vertebral fascia or layer. Now in this pre-vertebral fascia, why it is called pre-vertebral? Because it is present what? It is present in front of our what? Vertebra. That's why we said that this pre-vertebral fascia is divided into alar fascia, the outer one, alar fascia, and inside there is what? There is our what? This alar is outside and inside is our what? This is our pre-vertebral fascia proper. And inside what we talked? We talked that there is what? There is dangerous space, right? There is what? Dangerous space. So between these, okay, now between these what? LR fascia and let's say pre-vertebral fascia proper, right? Okay, let's mention is at proper, right? Pre-vertebral fascia proper, it is showing this region. There is what? There is our, what is there? There is our dangerous space. Dangerous space. Now moving from LR fascia, right? LR fascia is right here. Now this is what? This is our what? This is pre-tracheal fascia, right here. This is pre-tracheal, sorry, this is our what? This is our pre-tracheal fascia. Now what is this doing is, right, this pre-tracheal fascia right here is our buccopharyngeal fascia, right, buccopharyngeal fascia. Now between this buccopharyngeal fascia and our this LR fascia, what is there? There is one space. What is this space? That is our retropharyngeal space. Now why we are saying it retropharyngeal space? We are saying it retropharyngeal. Okay, what is here? Here it is our what? Retropharyngeal space behind pharynx, right? Now lies posterior to pharynx and cervical esophagus. Yes, this is our esophagus, retropharyngeal space. Okay, we talked about danger space also, lies between LR fascia, right? Where is LR fascia? This is our LR fascia and our what? Pre-vertebral fascia proper, right? Pre-vertebral fascia proper. And we talked about what? We talked about pre-vertebral space earlier. It is between what? Pre-vertebral fascia and vertebral column. This is what? This is our, let's say this is the start of our vertebral column, and between pre-vertebral fascia and let's say pre-vertebral fascia proper, okay, let's say okay, what is this? This is our vertebra. Now between this proper and vertebra, what is there? There is our this pre-vertebral space. Okay, these are about spaces. Yes, we talked about carotid seed earlier, right? This is our carotid seed, right? Carotid seed. Now here, right here, okay, these are the component of these pre-tracheal fascia. We need not to go right here right now. So this was what this was about, our the different spaces and fascias. Okay, it is the same diagram, right? Now in this diagram, what we need to do is, okay, we need to know about the carotid sheath contents. Okay, we have already discussed a bit about it. What is this? This is our common carotid artery or internal carotid artery. That is the medial component, right? Medial component. This is internal jugular vein, right? That is our lateral component. We have got in between, what we have got? We have got our vagus nerve, right? Vagus nerve. Now anterior to our this common carotid, anterior to our this carotid sheath, we have got ansa cervicalis, right? And posterior to it, we have got sympathetic chain. So this is important to know. Okay, now here, okay, in this diagram it is similar, but here we'll add something new. Need not to say what is this. This is our pre-tracheal fascia. What is this? This is our pre-vertebral fascia. The outermost one is our superficial investing fascia. Okay, these things we know. Now here what we are going to do is, we are going to know about we talked about carotid sheath. Now further, what we are going to know here is, we are going to get deeper into our this pre-vertebral fascia, because here we have got brachial plexus, the important one. This brachial plexus, right? This brachial plexus is present between scalenus anterior and scalenus medius, and here in between we have got brachial plexus. Now if you remember, the brachial plexus is, if you have gone through the lecture on our triangles of neck region, at that time what we talked, that in posterior triangle, right, there we will find brachial plexus, right? In floor of posterior triangle we will find brachial plexus. Now if you recall, what we discussed earlier is that, what is this? This is sternocleidomastoid muscle, this is trapezius muscle, and here these superficial investing layer is forming the roof of our posterior triangle, right? Now talking about roof, we said that it is made by our investing layer, but floor, it is formed by it is formed by our these pre-vertebral fascia. Now if we'll just go deeper to that, then what we'll see, that we'll see scalenus medius, we'll see scalenus anterior, and between we'll find brachial plexus. So brachial plexus is also found in posterior triangle. That is one important thing. Now let's talk about ansa cervicalis. Where is this ansa cervicalis located? This ansa cervicalis is located anterior to our this carotid sheath. Anterior to carotid sheath. Now what it will do is, it will supply It will supply omohyoid, sternohyoid, anterior neck muscles, right? Anterior neck muscles. We talked about we are into the nerve, right? We are into the nerve right now. We talked about brachial plexus, we talked about anterior cervicalis. Now we have already discussed that there is phrenic nerve, right? There is there is vagus nerve. In between our this, what is this? This is our common carotid. So what is this? Common carotid artery or internal carotid artery. This is our internal jugular vein. In between and deep to this, there was our vagus nerve. So now moving further, right? Moving further, what we need to know here is, okay, now this is the diagram. Here what is shown in this diagram? In this diagram we are going to see everything that we discussed. Okay, now here what we have, brachial plexus. In between, what is this? Scalenus anterior. Below there was scalenus medius. What we have vagus nerve right here, right? Vagus nerve right here. And above to these we were having ansa cervicalis. It is not shown here. So here what are these? These are thyroid gland, right? Thyroid gland. This is our trachea. This is our esophagus, right? This is our vertebrae, and above to this vertebrae we have pre-vertebral fascia. Here we have buccopharyngeal fascia, right? And here this is space. What was this space? This space was retropharyngeal space, right? Retropharyngeal space. Yes, we talked about what is this? The common carotid artery. What is this? This is our internal jugular vein, right? We talked about superficial investing layer that was enclosing some of the muscles like sternocleidoid mastoid. And what are these? These are muscular pretracheal layer. Muscular pretracheal layer. What are these? These are enclosing and the anterior neck muscles, right? Okay, we talked about all these things. Now schematic diagram at the end. Now in this schematic diagram, the same thing again. What is this? The outermost one, it is what? It is investing layer, right? Investing layer. It is enclosing some of the muscles like sternocleidoid mastoid, trapezius, right? Now what it is doing? It is forming the roof of what? Posterior triangle. Roof of posterior triangle. Now moving further inside, what we have? We have what? What we have? We have what? We have pre-tracheal fascia. Pre-tracheal fascia. What? These are pre-tracheal muscular fascia layer. This will include what? It will include anterior neck muscles like strap muscles, right? And here what we have? We have what behind what we have? We have the continuation of pre-tracheal fascia, but the name changes. Now it is buccopharyngeal fascia, right? Now here inside it, what is this? This is our thyroid gland. Here we have trachea. Here we have got esophagus, right? Now again, what is this? This is our pre-vertebral fascia. Now pre-vertebral fascia, what we have here vertebrae, right? Vertebrae. Now what? Now this is also what? This is pre-vertebral fascia proper, and above we have got what? Alar fascia, and this dendritic space, it is between what? It is between our what? Pre-vertebral fascia and pre-vertebral fascia proper. Now there is another space. What is that? That is pre-vertebral space that was between what? Pre-vertebral fascia proper and our what? Vertebrae, right? Now yes, we forgot to mention about phrenic nerve. Phrenic nerve is also present right here. Yes, we mentioned about this brachial plexus presenting between, what is this? This is scalenus anterior muscle and scalenus medius muscle, right? And this, what this brachial plexus will do is, it will just what? It will just pull our this pre-vertebral fascia, and it will just form what? Axillary sheath. So this is all about what? This is all about our what? Neck fascia and spaces. Hope we are clear on this topic. Thank you and have a great time.